everybody. This is Joe Freudenberger with OakBend Medical Center in Richmond, Texas, coming to you today with a cup of Joe. We're going to have a conversation around National Stroke Awareness Month with our Director of Quality and our Stroke Program Coordinator, BJ Patel. So welcome. Thank you very much. I'm going to share some things about stroke and how to recognize it, given that this is National Stroke Awareness Month. And it is a scary disease. I unfortunately don't have a history with it, don't want to have a history with it, but I do want us to be all educated on what to look for. So let's start off with, what is a stroke? Just so that we all kind of level set around that.
Okay, so since the May is a Stroke Awareness Month, I would say that stroke occurs here in every 4 seconds in the United States. Someone is having a stroke. Every 4 minutes, someone is having patient dies from stroke.
Okay.
So, and is a fifth leading cause of death and disability. I would focus on more is awareness.
But what is a stroke?
So stroke is interrupted blood flow to the brain of the part of the brain, or its oxygen is not providing to that area. Patients will get the stroke by having the vessel blocked or busted.
Okay, so you got a busted vessel or a blocked vessel preventing blood flow to the brain. Kind of a bad thing. Brains like blood.
It is.
Okay, I got it now. So what are some of the most common signs that you're having a stroke?
Stroke, common sign, and its warning signs is like, I can say the BEFAST acronyms that we need to remember.
Okay.
B stands for the balance or unsteady gait.
So you normally have a steady gait, and then all of a sudden you're losing your balance.
Right,
Something's going wrong in the brain.
Perfect. Yeah, that's the way I can say the B stands for.
Okay.
E, it stands for the vision changes. Sudden vision changes.
So vision changes,
yes. F for the facial drooping or asymmetrical smile line.
Okay.
A for the arm or leg weakness. S for speech, slurred speech. Patient would not complete the sentence.
Okay.
That way we can recognize that patient is having stroke. And T is for the call 911. Call 911, yes.
Okay, that's
in
not
emergency.
A sign.
Yeah, that's not a sign,
so
but call 911.
What's the acronym again?
BEFAST.
BEFAST. Okay. All right. And now, I'm generally, if I'm suffering the stroke, I'm not going to see these things, am I? It's really people around me that are going to notice the face droop, the slurred speech, the balance, et cetera, et cetera.
Right.
Okay, so it's really something for our loved ones to be aware
to remember,
of.
Yes. I think I would say that our loved one, family, friends needs to know the BEFAST and recognize the signs and symptoms immediately and call 911.
Okay. So this is one of those conditions that I don't want to wait on. Like, I decided to wait maybe a little longer than I should have for a DVT that I had, a blood clot. But this one, I don't want to wait at all. You get these symptoms, you immediately get into the emergency department.
That is right.
And why is that? Why is it so important that immediately I'm in?
Because the brain, it's time.
Okay.
As the past time, the neurons die.
Gotcha.
And neurons are dying, and patient will get the disability on the whichever the part of the brain it's ischemic.
So the longer it takes for me to get into the ER, the more damage can be done to my brain.
That's absolutely right.
Absolutely right. So let's flip and talk specifically about OakBend and OakBend Stroke Program. So OakBend has had a stroke program since 2006. 2006.
Yes.
Okay. And so what capabilities do we have as it relates to strokes?
Since 2006, the OakBend is a primary stroke center. We have evidence-based practice, strong protocols, standardized policies, and I would say that we have a strong neurologist and telemedicine group, and that's our core team. It's ER doctors who are specialized in the stroke cares, ER nurses who are specialized with the stroke cares, and our team that are responding quickly to the stroke.
So a certified stroke program provides a greater degree of assurance to a patient that the whole process, the physicians, the staff, the protocols, the policy, procedures, they're all geared around achieving your best possible
Outcome. That's
Okay.
absolutely right.
So, is there a person, I mean, what would make me more at risk for a stroke than another person?
Actually, chronic condition, I would say, because every patient's chronic condition would have a high risk for the stroke, like high blood pressures, high cholesterol, obesity, heart disease such as arterial fibrillations, AFib, and diabetes.
Diabetes
and
too.
and I think I some that included excessive amount of alcohol use that can be risk factors too.
Really?
And smoking
Okay.
also.
Smoking.
Yes.
Wow.
Yeah,
Well, that's a pretty long list
it
of
is
things
it
that could
is
put you at risk.
That's right.
Can you share a success story about a patient who came in and had a pretty serious stroke and succeeded
Mhm.
in getting better?
Sure. I remember the one patients that came in our Jackson Street campus to get the stroke care. 39-year-old, pretty young guy, came here with the family member, uh, little kids, and the wife. Came in the ER. Patient was not recognizing at all anything. He was AMS, ultramental status, confused, dizziness, and he had a very small window to get the treatment because there is a window. It's called a 3 to 4.5 hours window. Patient should have get the treatment.
Okay, and
So
that's the
that
clot busting
clot
drug.
busting medicine. That's
Okay.
absolutely right. That's a TPA. So when the OakBend alert the team saying the patient is on ER, I went myself and helped the ER staff. And I saw the patient. Patient was confused, not recognizing, and we had a very small window. So as soon as the CT done and we confirmed that patient is having ischemic stroke, doctor and the nurses prepare the medications. We give the bolus. First, we give the bolus, and I have seen that patient's changes on his life, and OakBend prevented the disability.
Okay.
OakBend saved someone's life, and it was heart touching. I would not forget that patient's face in my life.
Oh, wow.
Yeah,
Wow.
that was a huge change.
So getting that clot busting drug on board as quickly as possible is essential. And we can do that at all of our ERs. So
Yes,
that is
yes.
not something. So people shouldn't be thinking, oh, well, let me go to where my doctors are with this particular condition, because wherever the closest ER is where you need to go
Right.
to get that clot busting drug on board as quickly as possible.
I would say that primary stroke center, like
Right.
Jackson Street and Williams Way campus, both are capable to give that medications. We have well-trained nurses that who
Gotcha.
knows how to prepare the medication, because that is a technique to prepare the medicine.
Got it.
So I would say that closer to the home, but it's a primary stroke center or comprehensive stroke center.
Got it. So typically, if I've had stroke, I'm going to have some recovery challenges. So tell us a little bit about the recovery process.
The recovery process has a 3 phase. First, I would say that strength training. Second is independency, and then third is confidence. The first, I would say, the strength training by getting the right time PT therapy, and PT therapy will focus on the strength.
Gotcha.
Getting back to strength wherever the weakness are. And then I would say independency, they will work, occupational therapy will work on a patient's independency, getting back to the normal life. Whatever the disability patient was getting, they work on it, get the strength back, get the daily routines, work on them. And the third is confidence. The patient will have a confidence, and they will do better and better outcomes. So that's one, by giving the confidence, by starting the right away rehabilitation program, that's very important.
And so I would assume, and so you tell me if I'm right, that our physical therapy department, because we're a primary stroke center, is seeing more stroke patients than maybe an average physical therapy outpatient site might. And so is that a reason to consider OakBend or any hospital that has a stroke program, their physical therapy program?
That is right. I would say the stroke program is hardwired the therapies, because as soon as the patient comes, the protocol and the policy has in there saying that PT therapy, occupational therapy, speech therapy has to be started first 24 hours. Do not wait. Do not
Okay.
wait.
Okay.
Starts right there and then, and work on it before the neurons get damaged and die.
Okay. So that physical therapy, occupational therapy, speech therapy, that happens in the
In the
hospital.
hospital.
Then we take it into our skilled nursing facility, and then ultimately to the outpatient setting for the complete rehabilitation. Does it happen quickly, or does it take a while to rehab from a stroke?
It as fast as you start the rehabilitation program, patients' outcome will be better.
Gotcha.
Patients not going to get the disability really, I would say that really bad, but it would be disabled. But as you work, it will be getting better.
Gotcha. Okay. And then last question, is there, if I have one of these chronic conditions, high blood pressure, diabetes, smoker, alcohol, what have you, is there something I can do to get a test that will tell me if I'm more probably going to experience a stroke? Is there anything I can do from a screening standpoint?
I think the screening standpoint, if it's like if it's heart related problem, I would say the calcium scoring score, or if your blood pressure is on high range, then you should take the management program for the focusing on getting the better blood pressures control, like controlling the blood pressures. If you are diabetics, then you have to manage the diabetes. But I would say that everyone has their own personalized risk factor, and they have to know that. By coming to the primary stroke center, getting the treatment, every doctors in the ER or the neurologist will focus on their personalized risk factors for the patients and work on that, so patient will not going to have another stroke in the future.
So for a person that doesn't have a family history of stroke, my primary care physician would be the physician that I should talk to about the possibility that I might have a stroke in the future. Or if I'm going to see a cardiologist, the cardiologist would be the person that would be best able to help me to assess whether that is a possibility.
That is absolutely right.
Okay. Well, this has been really informative. Thank you so much, BJ.
Thank you so much.
Thank you for your being shepherding this program for as long as we have had it. You've done a fantastic job. And thank you all for joining me on A Cup of Joe. And I look forward to seeing you another time. And we'll learn more about our health and our challenges. Have a great day.